Good day, I am Zamzamin Dicay, and today I'm going to perform the Unang Yakap, the Essential Intrapartum and Newborn Care. The first procedure prior to woman's transfer to delivery room ensures that the mother is in her position of choice in while in labor to promote relaxation and comfort. So, good day, ma'am. I'm your student nurse for today. Are you okay for your position right now? And the next procedure is ask mother if she wishes to eat or drink or void. So, meron po ba kayong gustong kainin, ma'am? Or inumin? So, thank you. Then, the next is communicate with the mother, inform her of progress of labor to give reassurance and encouragement. So, ma, relax lang po tayo. Then, maya-maya is nasa delivery room na po tayo. Then, next is the when the patient is already in the delivery room preparing for delivery, uh, check temperature in delivery room area to be 25 to 20, 28 Celsius to eliminate air draft. Then next is ask the patient if she is comfortable in the semi-upright position. Proper positioning ensure better visualization. So, ma'am, okay lang po ba kayo sa inyong position?
Yes.
Sa ng semi-upright position?
Yes.
Thank you. Then, next is ensure the patient's privacy. Then next is remove all jewelry, then wash hands. Once wash hands thoroughly. Then next is prepare a clean newborn resuscitation area on firm and flat surface. Check the equipment if clean and functional within easy reach. Then next is arrange the materials or the supplies in a linear sequence. Then next is and for the materials or the equipment, the 2 pairs sterile gloves, 2 pieces of dry linen. Then next is the 1 bonnet, the oxytocin injection. Then next is the plastic cord clamp. One surgical scissor. Then the kidney basin. And for the in the separate sequence for after the first breastfeed, the eye ointment, the stethoscope, cotton balls, the 3 hypodermic 1cc syringe. Then next, the vitamin K injection, hepatitis B, and BCG vaccines. Then, then next, then next is then then next is wash hands and put 2 pairs of gloves aseptically. At the time of delivery, encourage the patient to push or desired to provide support system. So, kalma lang po tayo, ma'am. So push lang tayo. 1, 2, 3, push. 1, 2, 3, push. 1, 2, 3, push. Then, drapes the clean. The dry linen over the mother's abdomen or arms in preparation for drying the baby. One, two, three, push. 1, 2, 3, push. 1, 2, 3, push. Then next is apply perineal support and thus control delivery of head. Then cause of time of birth and sex of baby. So baby boys out 7:30 p.m. Then next is inform the mother of outcome. So congratulations, ma'am, for your baby boy. Then next is thoroughly dries the baby for at least 30 seconds, starting from the face to the head, then going down to the trunk and extremities while performing a quick check of breathing. Then removes the wet cloth and places the baby's skin to skin contact on the mother's abdomen or chest. Then next is covers baby with dry cloth and the baby's head with bonnet during the 1 to 3 minutes. Then next, exclude the baby by palpating the abdomen and preparation for the for the giving oxytocin. Then uh, then gives oxytocin within 1 minute of baby's birth. After wiping the soiled gloves with the wet cloth, then dispose the wet cloth properly. So, ma'am, habang nag skin to skin po tayo ng inyong baby is magbibigay po ako ng oxytocin. Ito po ay para maiwasan ang excessive bleeding. So, magtuturok na po ako. 1, 2, 3. Then, next is remove first set of gloves after positioning the baby for cord clamping. Then, during the 1 to 3 minutes, palpate the umbilical cord to check for pulsation. Then next is, after pulsation stop, clamp the umbilical cord using the plastic clamp or cord tie from 2 cm from 2 cm from the base. Then place the instrument clamp 5 cm from the base and cut near plastic clamp, not midway. Then waits for strong uterine contraction. Then apply controlled contraction and countertraction on the uterus, continuing until placenta was delivered. Massage the uterus until it firms. Then next is inspect the lower vagina and perineum for laceration or tears, and repairs laceration or tears as necessary. Then examine the placenta for completeness and abnormalities. Then cleanses the mother, does the perineal flossing, then applies perineal pad or napkin. Then next, is checks baby colors and breathing. Check the mother's if is she is comfortable and that the uterus is is contracted. So hello ma, are you okay?
Yes po.
Then next is dispose of placenta in a bag leak proof container or plastic bag. Then decontaminate the instrument before cleaning. Decontaminate second pair of gloves before disposal, starting that decontamination lasts for at least 10 minutes. Then next is uh, the next is advises mother to maintain skin to skin contact. Baby should be prone on mother's chest and between the breasts with head turned to one sided. Then next, advise mothers to observe for feeding cues and cite example of feeding cues. So by 15 to 90 minutes. So ma'am, panatilihin na lang pong naka skin to skin kayo. Then after a while, hintayin nyo po yung baby nyo na pansinin nyo po yung baby nyo kung ito ay nakanganga or hinahanap yung ang inyong nipple for the breastfeeding. Then support mother, instruct her on positioning and attachment. Then wait for full breastfeed to be completed. Then next is to then after complete breastfeed, administer eye ointment. The thorough physical examination, then given the vitamin K, hepatitis B, and BCG injection. So ma'am, pagkatapos ng inyong breastfeeding kay baby is mag-inject po tayo. First is galagay po tayo ng ointment para maiwasan yung bacteria. Ointment sa mata para maiwasan yung bacteria na pwede mag-infection. Then for the tuturukan po natin siya ng tatlong vaccine, the vitamin K, hepatitis B, and BCG injection. Alam po natin na ang sanggol is kulang sa vitamina. So mag-inject po tayo. Then the first apply eye ointment. Then physical examination. So normal naman po yung physical, yung kulay. Then administer her the vitamin K. Then second is the hepatitis B para po ito maiwasan ang pagkakaroon ng HEPA. Then next is the BCG. Ito po ay para maiwasan any form of tuberculosis. Then advice is optional. Bathing of baby. Then ma'am, so within 6 minutes hindi po natin pwedeng paliguan ang ating baby po kasi pwede itong magka hypothermia na or pagbaba ng kanyang normal na temperature. Then next is advice breastfeeding per demand. So ma'am, pasusuin po natin ang ating baby as demand. Then check for baby's breathing and color, and check mother's vital signs, and massage uterus every 15 minutes. The next is complete all records in the second hour. Accurate documentation allows us for comparison of data. So that's all. Thank you.